Okay. All right, so 2:05, I think we are ready to go. Welcome everyone to session 4B, Environmental and Community Health in Northern BC, from Sustainability to Youth Engagement. This session will feature a series of oral presentations highlighting current research, evaluation, and quality improvement projects. Each speaker will have 15 minutes to share their work, followed by 5 minutes for questions and discussion. I have nifty little time cards, which I'll pop in the chat to visualize the timing. Unfortunately, if we hit that 15 to 20 minute mark, I do have to verbally interject and we will need to move on to the next presenter. Participants, a gentle reminder to keep your cameras and microphones off during the presentation and direct your questions or comments to the chat. Jonathan is our first presenter, who will be presenting on elevating youth voices to promote healthy futures in the Nechako Watershed, insights from efforts to address the nexus of climate change, community, and health. Jonathan, I invite you now to turn on your video and mic, share screen, and begin presenting.
Awesome. Thank you, Steph. And just so you know, I have a stopwatch going on my end too here, just in case.
Okay.
Let me know if you can all see my screen.
Yep, looks good.
Okay, awesome. I'll start the time. So thank you very much for attending my presentation today, folks. I'm very excited to be here. My name is Jonathan. I'm currently in the midst of completing my Master's of Health Sciences under the supervision of Dr. Margot Parks. And it's wonderful to be here to talk about youth engagement with you all. So I'd like to begin and just express how grateful I am to have lived in PG on these beautiful unceded territories of the Lheidli T'enneh. I've been here for 27 years now, all my life. I found my wife here, I got married here, and we certainly plan on calling these territories home for the rest of our lives if we're so fortunate to do so. So for the remaining 14 minutes, I won't be able to go too deeply into my research and findings, but I am very excited to provide you all with a glimpse of youth engagement work within the Nechako and how my findings will hopefully contribute to a larger conversation within the watershed about collaborating across generations to address climate and health issues. I'll provide some relevant background information that helped fuel my current research, including some collaborations within the Nechako and the history of how it unfolded, in addition to 3 very influential watershed-based gatherings. I'll dive into my research question and objectives, briefly go through the methods, and then talk about my 4 themes in addition to some practical considerations to make youth engagement more enjoyable and beneficial and to improve their confidence and competency. So broadly speaking, this research is concerned with the ongoing challenge of attending to the health needs of rural, remote, and Indigenous communities who are more susceptible to disruptions in social ecological systems and further experience greater climate change and resource extraction impacts. Now, these overlapping crises have essentially awakened a growing demand that complex challenges at the intersect of climate, community, and health must be addressed in such a way that overcomes silos. So this means cultivating synergies across cultures and knowledge systems and also across different sectors. However, it would appear from the literature and my own anecdotal experiences working with Margot and other researchers is that there is this increased recognition that we need to create more opportunities for genuine dialogue about and relationship building with youth who are going to be the inheritors of the future, who are going to have to confront whatever the world looks like over the next decades. So the Nechako really is it's an awesome microcosm of these boundary crossing collaborations that have also prioritized youth engagement. Now, the work that's been done around youth within the watershed can be primarily attributed to complementary partnerships over the years, including the Integrated Watershed Research Group, which brought together researchers across the natural health and social sciences to provide youth with volunteering and employment opportunities. the Nechako Watershed Roundtable, where I'm currently working as the youth representative on the core committee, sort of volunteering, not working. But they aim to bring together youth across jurisdictions to promote watershed stewardship and security and to help bring their voices into the governance landscape. And then the Environment Community Health Observatory Network, which had a youth branch and showcased local youth climate projects and initiatives across Canada. Now, all of these in particular worked in conjunction with one another with a shared vision that ultimately helped establish the co-learning in our Watersheds program, which was a UNBC School District 91 partnership to elevate youth voices and enable hands-on experiential learning opportunities so that youth could take a more active role in contributing to the health of their communities. And that little red circle you can see at the end has to do with the fact that code did end. And now with my work, with my thesis and my work with the NWR on the core committee, we are still trying to generate the momentum forward and continue these initiatives. Now, co-learning in particular was responsible for creating 3 specific uppercase G gatherings that, to my knowledge, were incredibly unique insofar as they provided a completely new experience for youth to engage with public health workers, Indigenous elders and knowledge keepers, lawyers, professors, folks from all kinds of sectors. And the gatherings were explicitly tailored to elevate youth voices, to give them a platform to express their ideas, concerns, and hopes with a group of people that they probably would have otherwise not interacted with in this kind of context. Now, these 3 gatherings occurred, the first one in Cowichan in 2022, the second one in Stellatin, in Vanderhoof, in May 2023, and then the third one was in Grand Isle in June 2024. And it's important to reiterate at this juncture that all 3 place-based gatherings were Indigenous co-designed. They were predicated on Indigenous ways of knowing and being, and for that reason, these gatherings did encourage youth and adults to spend a great deal of time dialoguing, connecting, and learning together in nature. So with that said, based on these gatherings, based on the literature, I wanted to explore, okay, what worked well in the Cowichan and the Stellatin in Grand Isle? What didn't? How could we improve? And what kind of insights could we take away if we wanted to continue doing this work in the future? Which we do want to do. The question is, how can youth voices be elevated in strength-based ways to address interconnected climate, community, and health issues and promote healthy futures in the Nechako? The first objective is to identify these attributes that strengthen our capacity to elevate youth voices when we engage in these sort of cross-cutting gatherings that include multiple different voices. The second objective is to explore insights about how youth voices and efforts can actually contribute to transforming their communities in future. So focusing on that sense of agency over their well-being. So very briefly, I conducted 12 interviews. There were 12 participants in total, 3 youth, 9 adults. We had folks from education, public health, Indigenous knowledge keepers, and 1 individual in particular that works in watershed governance. The inclusion criteria for who I chatted with were folks had to be involved in 1 of the 3 gatherings, and then I did a thematic analysis to uncover my codes and eventually my 4 themes. So the most prominent theme that was reiterated most often was the importance of foregrounding youth engagement experiences within the context of place. The first theme captures how connections to place is beyond simply being in some sort of geographic location, but about entering into a web of relationship with the lands, with the waters, and with an understanding of the historical, political, and cultural contexts that shape it. There are 3 sub-themes within this theme. The first one concerns itself with how focusing on place and consequently incorporating Indigenous cultural practices and knowledge systems throughout the gatherings helped empower youth to speak and take action, especially Indigenous youth, by strengthening their sense of identity and confidence in their traditional languages and practices. The second sub-theme touches on how grounding and spending more time in nature help to facilitate youth-adult interactions by simply enabling them to feel better in the broader sense. And this is often overlooked, but it did help them to be more open to hearing different opinions, especially regarding youth. And I think this is very important when understanding that these climate change conversations can surface tensions. They can be very stressful. And so feelings of decreased anxiety, more joy, more peace are very, very beneficial. And thirdly, the third subtheme underscores the ways in which interacting with the forces of nature, challenging weather, terrain, actually helped encourage a sense of bonding and connection between the youth and the adults, because participants shared stories about how being vulnerable and subject to the cold, to the rain, became a basis upon which compassion could be cultivated. So that was really interesting. The second the second theme also has to do with the practical and educational benefits of connecting to place, and consequently the outdoor and experiential learning that follows. Once again, there were three sub-themes categorized under this. The first one, youth participants in particular, contrasted more unidirectional classroom learning settings with the outdoor experiences that they got to do at the gatherings, preferring the latter. And they unanimously shared that the learning that happened, firsthand in nature enabled them to feel more interested in the ecological integrity of their communities and deepened their understanding of climate change and its collateral impacts in society. The second sub-theme, participants described that providing youth with both Indigenous and Western ways of knowing strengthened their capacity to deal with complex challenges by expanding the resources and knowledges that they can pull from. And the cross-fertilization of knowledges was something that was central to these gatherings. The third sub-theme concerns itself with how youth displayed a very impressive capacity to see and think in integrative ways. And this is obviously very crucial when we try to confront the array of interrelated ecological and social determinants of health that influence our communities. So to say it otherwise, engaging in these sort of hands-on, place-based experiential learning helped to cultivate and bring about an already existing strength that youth possess when dealing with complex challenges. The third theme addresses how, while these gatherings can successfully, create positive intergenerational experiences, a notable drawback that also pertained to youth engagement in general, especially within the literature, was how their efforts and their voices tend to remain confined to the immediate context of the event. Their contributions, therefore, are more likely to be ineffectual in the long run as they dissipate gradually with time. And so participants provided three main ways that they thought we could overcome this dilemma and foster a sense of continuity. Once again, there are three sub-themes within this theme. The first one suggests that involving youth in the planning process as co-designers can amplify their sense of leadership, give them proper agency over what their experiences will be like. And if we know we're going to gather, or if we aim to gather multiple times per year, and we know we're going to meet with them beforehand, that will also encourage a sense of continuity. The second sub-theme had to do with partnering with the school district to systematize these processes. That was something that we learned with co-learning that was incredibly valuable because we were meeting about 3 to 6 times per year. And that really helped facilitate opportunities for meaningful engagement that responded to youth interests and priorities. So the ending of co-learning is a loss that we've really felt and we're trying to build upon. The third sub-theme has to do with connecting the learning that students do in schools to these community-wide gatherings. So that, for example, the learning that they did at the Stellatin, could it be adjacent and related to what they're learning in schools, and to make the two sort of interdependent on one another, where what happens at these community-oriented gatherings is also covered in what happens in the classroom. And I think that is something that's a really cool ideal to strive for, but we're not quite there. But I was really interested by the fact that participants brought it up. Now, the final theme concerns itself with the dispositions that adults bring into gatherings. Youth were incredibly attentive to the fact that they were perceptive that adults really did make genuine attempts to create welcoming and thought-provoking spaces to demonstrate their care and respect towards youth, and that they really wanted to hear what the youth had to say. Instantiating this ideal that just irrespective of your age, we are all here to learn together with our own knowledges, our own experiences, and our own expertise. The other thing that was really interesting was that youth were perceptive to the fact that the adults were really trying to cultivate hope and optimism, that youth can make a difference. And this is especially important in a world, especially the online social media world, that can seem very doom and gloom, very anxiety inducing. and youth certainly pick up on that. And one of the quotes that was shared on the top there, resilience is based on two general things. One, that you matter and people like you matter. So therefore, you have to take seriously the way you live in life. And secondly, is that you can make a difference. And I just thought that that really beautifully encapsulated what all of really the participants emphatically described throughout the interviews. So being aware of the disposition that you're carrying into the gathering really goes a long way, and youth do pick up on it. Now, in addition to these themes, I just wanted to finish off by flagging a few practical considerations that participants described as making the gatherings way more enjoyable and productive with the youth. The first one is to harmonize structure with flexibility. No agenda creates chaos. Too much agenda doesn't allow for those spontaneous moments of joy and play, which really helps to humanize the interactions between adults, youth, elders, and helps them to feel more comfortable to speak their minds, which is really important and the whole point of why we're trying to engage with them. The second is that climate conversations, as I just mentioned, can be really overwhelming, coupled with the fact they're often encompassing of difficult stories of colonial practices that were very destructive and cruel to Indigenous peoples. And so allowing time to sit in what we've talked about, to decompress and to reflect, was described by the youth participants as really, really beneficial for their learning and their engagement. And finally, the near peer idea, which is that youth often felt more comfortable and willing to participate when surrounded by near peers. Young adults, primarily graduate students in the context of the gatherings, who were less far removed from their own stages of life compared to some of the older adults, was a cool thing that they picked up on. And this closeness in age and life circumstances helped bridge the gap between younger and older participants. And I can see I'm at the 15-minute mark. So thank you so much for listening. I really appreciate it. And I'm happy to take any questions right now. And also I can leave my email in the chat for folks that might want to just follow up afterwards. So thank you very much. And I can stop sharing my screen now.
Oh, that is such a cool project.
Thank
Right
you.
on. Yeah. So we do have a question in the chat from Marcelo. He says, quite unique research. Can you speak about how these findings build, confirm, or reject prior evidence around youth and climate change literature?
Yeah, absolutely. I think what was kind of unique about this project was that a lot of the literature, this is going to come to no surprise, a lot of the literature that I read and that I compiled in my lit review really focused on youth in urban settings. And it also talked about more so global initiatives, for example, that are happening with the WHO. And so to say whether these findings kind of rejected or confirmed is not necessarily possible to the extent that we don't have much to compare it to, because there isn't even a lot out there about youth in these smaller, rural, remote northern communities, right? What I would say though is that it does coincide with the general idea that there is a recognition that youth do want to be involved in movements of social justice, of ecological justice, and that they actually do want to confront the challenges that they very well perceive are coming their way. What I would say though is that in terms of rejecting prior evidence, I think one thing that's really interesting is that the literature is kind of undecided on what the sort of cataclysmic language around climate change, whether that actually tends to fuel youth or actually demotivate them. And what I found from at least the youth that I spoke with is that they were motivated by having a heightened sense of awareness of what was happening. That's kind of what I was speaking to in that sort of experiential learning, is they actually wanted to go and learn about how the 2018 Shovel Lake fire impacted Stillatin First Nation. They wanted to go and really seep into the destruction of it because they would rather have an awareness of what's going on, but they also want to be fed the proper knowledges and tools so they can feel competent in doing so. And that's where the different, kind of blending maybe the more traditional sciences, with Indigenous sciences and knowledges, and expanding their toolkits and stuff like that, so that they can feel I have something to move forward with. I'm not abandoned, I'm not alone, and the adults care about us, and we're doing this together. So I hope that somewhat answered the question. But because, like I said, because there's not a lot in the lit review about these communities and these youth, it's kind of tough to compare it to something. So thanks for the question, though, Marcelo. I appreciate it.
Yeah, that's great. So it sounds like there's a lot of hope building with it. So that's kind of neat. Yeah. Okay. Well, we are going to move next to our next presenter. Thank you so much, Jonathan. Next, we have Debbie, who will be presenting on reducing single-use plastic in systemic therapy medication transport, a planetary health initiative at BC Cancer Centre for the North. Debbie, I invite you now to turn on your video and mic, share screen, and begin presenting.
Okay, thank you. Can everybody see it and hear me?
Yes.
Yes, okay, thank you. All right, thanks everyone for coming. My name is Debbie Milligan, and I'm a registered nurse at BC Cancer Centre for the North in Prince George. Today, I'm excited to share one of our team's planetary health initiatives, which aimed to reduce single-use plastic, which is Ziploc bags is what I'm talking about, in systemic therapy medication transport. So this project came about because last year, PHSA nurses were given the opportunity to participate in a 12-week internship dedicated to learning about quality improvement projects and environmentally sustainable healthcare. So each participant then implemented a project of their choice, and this is my project. Oops. Hold on. Okay, now I'm going to need help. There we go. Okay. So I'd first like to acknowledge that we're living, working, playing, and raising our families on the traditional lands of the Lheidli T'enneh, who have lived on and cared for these lands for generations. There, okay. So the first thing we're going to go through is some definitions so that we're all speaking the same language. I'm going to talk about climate change and some of the health impacts on global warming. I will talk about healthcare's contribution to climate change, and then I'll get into my project. So, greenhouse gases. Greenhouse gases are gases in the atmosphere that trap heat from the Earth's surface, preventing it from escaping into space. So I picture this like a rain jacket. You're walking around in your rain jacket and you get really hot, and that air does not escape. That heat does not escape from your body because it's trapped by that jacket. The jacket is the greenhouse gases, keeping the heat in close to the Earth. So the main greenhouse gases we're talking about are carbon dioxide, methane, and nitrous oxide. In terms of climate change is a long-term shift in global weather patterns and temperatures. The main cause of climate change, or global warming, is increased greenhouse gases. And then planetary health. This is a concept that human health and the health of the Earth are deeply interconnected. So simply put, a healthy planet equals healthy people, healthy populations, healthy living and non-living systems. But then the opposite is also true. So sick or unwell planet equals sick or unwell people. It cares not just about people right now, but also future populations and the ecosystems that sustain us as human beings. So to link these three all together, planetary health is affected by human actions which produce greenhouse gases, in turn increasing climate temperatures and decreasing the health of people and the Earth. So, why does planetary health matter, and what does it have to do with the healthcare system? Health systems generate substantial greenhouse gas emissions. In Canada, the health sector accounts for 5% of our nation's total greenhouse gas emissions, which is second only to the oil and gas industry and the transportation industry. It's also the second highest rate per capita in the world. So healthcare generates greenhouse gases through energy consumption, waste generation, and resource use. So think lighting, cooling, and heating hospitals, single-use medical items, transportation of medical supplies. So these emissions worsen health outcomes, creating a feedback loop of harm. Now, still, is this really something we need to worry about? So climate change is no longer a future threat. It's a present reality. Do any of these terms sound familiar? Heavy rainfall events, bomb cyclones, atmospheric rivers, wildfires, extreme heat warnings, evacuations, boil water advisories, longer allergy seasons. These are not abstract concepts. These are direct consequences of the changing climate already affecting our daily lives. So here are some examples closer to home. So this is the fire in Lytton that burned down the whole town in 2021. This is the atmospheric river in Abbotsford. We see this every summer at the CN Center, the emergency reception area. The heat dome in 2021, where 619 people died in 1 week. Common scenes from our springs and summers in the last few years. Evacuations of entire towns in BC, unable to work, to go to school, to get healthcare. This is a 9-year-old boy from 100 Mile House, Carter Vig, who died of an asthma exacerbation in 2023 because of wildfire smoke. So, what are the health impacts of climate change? Well, as the previous slide already hinted, extreme weather events can lead to injury, death, and limited access to essential supplies. Heat stress can result in heat stroke, dehydration, even death. Air pollution worsens respiratory conditions, increases the risk of lung cancer, and contributes to premature mortality. We're also seeing ticks and other disease-carrying insects spreading into regions where they weren't previously seen, leading to increased transmission of infectious diseases between humans and animals. Sorry, I was still on this slide. Climate change also threatens food security and water quality, contaminating fresh water sources and leading to gastrointestinal illnesses. So this is now a specific example in my workplace of how healthcare itself is contributing to poor health outcomes. So at BC Cancer, our mission is to reduce the burden of cancer in BC. So if we're going to do that, then it's essential for the healthcare sector to adopt more sustainable practices. So this is me. I am giving chemotherapy to a patient. Chemotherapy drugs are classified as hazardous material. So anything contaminated as hazardous must be disposed and designated in a hazardous waste bin. So things like plastic bags. So once these filled hazardous waste bins are, once they're filled, the hazardous waste bins are transported to an off-site disposal facility. The transport truck emits greenhouse gases during the journey, contributing to environmental pollution. Hazardous waste must be shipped all the way to Portland, Oregon, increasing the risk of the footprint of increasing the environmental footprint of disposal. In Portland, the waste is incinerated, a process that can produce up to 30 times more greenhouse gas emissions than alternative disposal methods. Incineration also releases harmful pollutants into the air and environment. These toxic emissions can travel long distances via air and water, affecting human health, livestock, and ecosystems far from the incineration site. Pollutants can return through wind, waterways, and agriculture, meaning the environmental effects eventually circle back to patients, nurses, and communities. So now that everybody's feeling down, there is hope, and it's in projects and initiatives like this. So as the title of my presentation suggests, my goal was to reduce the number of single-use plastic bags, so Ziploc bags, being discarded in the systemic therapy department at BC Cancer. Why? Because it feels wrong. It makes you feel like a really awful person to be throwing out countless clean-looking Ziploc bags every day. And that's what we do. So for context, I'm a systemic therapy nurse. I handle hazardous drugs all day long. The pharmacy prepares these medications and nursing staff transports them a short distance within our building from the pharmacy to the chemo unit. There are strict regulations around how to safely transport hazardous drugs, which involve multiple layers of Ziploc bags and hard plastic bins, like a Tupperware kind of thing. Of course, safety is the top priority. However, I did start to wonder if there might be a better way. So I took a closer look at the regulations governing the transport of hazardous substances, and it turned out there was some wiggle room. I initially wanted to get rid of all Ziploc bags and just use a reusable hard plastic, like Tupperware container, which was a no-go. But we did discover that we were overdoing it, and we could get rid of one layer of the plastic bags. So my goal was to permanently eliminate the use of the second sealable bag by the end of the year. So this was 10 months ago. So the first thing I did, as I said, was study the regulations in BC for the transportation of hazardous material. I gathered baseline data on our current usage of sealable Ziploc bags. I obtained approval through the Provincial Pharmacy Professional Practice Council and our local pharmacy to make this practice change. And then I provided a briefing to pharmacy and nursing staff highlighting the plan and letting them know that the new process met safety standards. That was the biggest concern. People were super on board. I had planned to start on a Monday because that's logical. But everybody was like, no way. We can't, we have to start now on the Wednesday or whatever it was. So we did, we started right away. And then I continued to track the same data, how many plastic bags were coming through. And I just continued to check in with everyone to see how things were going. So prior to project implementation, Center for the North used approximately 70 extra sealable bags per week, or 3,666 per year. And that's enough to feed a school child a bagged sandwich lunch for 19.3 years of education. So what were the outcomes? Well, we had a 100% reduction in the extra bag usage, and that continues to this day. So that became a permanent change. So the before is in the blue, and it just goes up and down there. And that's based on how many people we're treating each day and how many medications are coming through. And then the purple is just afterwards. Other impacts were financial. So decreased cost of actually buying the Ziploc bags, decreased cost of the hazardous waste bins that we weren't filling as quickly, and the decreased cost of incineration because we weren't filling as much. Environmentally, decreased extraction of natural gas and crude oil from nature to make plastic bags, decreased greenhouse gases from production, shipping, and incineration of Ziploc bags. Psychologically, there's lots of research to show that knowing that we're actively taking steps to protect the environment makes people feel good. And that's obvious in the feedback that I've gotten from staff as well. Time, everyone's working short-staffed to produce the same amount of work. This project change decreased the number of steps needed to check medications and get them out to patients. And it also decreased the time and strain for nurses and pharmacy techs to open and close, and then open and close Ziploc bags, which might not seem like a big deal, but you know, when you get back from Costco and you have to open up all your bags and you're just like swearing as you're trying to rip them open, that's what it's like constantly trying to get the medications out of the bags. And then lastly, just education and networking. So I got to provide planetary health principles, education to other areas besides nursing, which was really nice. So this is one of my favorite slides. This was not our first sustainability project. Over the last year, we've replaced disposable blue pads with reusable cloths when we start IVs. We've improved waste sorting, hazardous sharps, recycling garbage. So then again, we're cutting down on the amount that we are sending to be incinerated, or, you know, recycling is being recycled instead of just going in the garbage. The take-home bundles that we send for people that are going to disconnect their chemo at home are now supplied in paper bags instead of plastic bags. It's an easy switch. Expired supplies are now sent to CNC for nursing practice instead of just being thrown in the garbage. And coming soon is small garbage bin removal project to reduce single-use liners in those like small office garbage bins. So lessons learned is the number one thing is just challenge the status quo. Sometimes things are done in a certain way because they've always been done that way. But it doesn't mean that that's the best way or the only way to do things, or even the correct way, as we found out with this one. Small changes can make a big difference. When I look at the list of these initiatives that we've done, that's just our site, and we're the smallest BC Cancer site. If other sites were doing the same thing and doing their own projects, in other areas in BC, like it adds up quickly. Staff engagement is key. So in healthcare, there's so many changes always coming, and change fatigue is a real thing. But when you tell people why, you share the why we're doing this, there was never any hesitation. Everybody was on board and wanting to do it. And then sustainability and safety can coexist. So in conclusion, this initiative shows how small evidence-based actions can create ripples of positive impact, reducing waste, improving efficiency, and strengthening our commitment to planetary health, which ultimately contributes to improved health for everyone. So I just wanted to thank everyone that helps me with this project and my references, and that's it. Are there any questions? I've just got to figure out how to stop sharing. Here we go.
There you go. That is awesome. Yeah, we have some questions that have popped up. Amy?
I'm just sliding up here. Okay. What are some resources or actions one can take to start addressing environmental impacts in healthcare? Honestly, I think a lot of it is just looking around your own workplace and like thinking about, like say the garbage bins, right? We have millions of those little garbage bins everywhere. Just taking a few away means we're not just throwing out those extra plastic bags every time. There were projects done on faxing versus e-fax instead of just faxing and printing out all the papers all the time, right? So someone transferred that over. That's an easy thing. I think there are a lot of, depends on your background, I guess. There are some, in nursing, some resources for green initiatives that can help give you ideas. But I think it's just really about looking in your workplace and seeing like what drives me nuts. Because like the plastic one, that was it. I was just like, it makes me feel so bad to do this. So what can we do? And honestly, just looking into what the regulations were and realizing like we're not even doing this right, and it was a bit of a fight to get to the right people, but in the end it makes such a big difference. Plans to expand this project to other sites. So other BC Cancer sites, some are looking into it. Sometimes because of the size of places, things have not been as easily adapted. Or they were doing it differently. And some of that has to do with, well, how far away do they have to transport the chemo? So yes, this is happening at other sites, but not all sites. Yeah.
Sorry, we do have Amy who's had her hand up.
Okay.
Amy, would you like to jump in and ask a question or comment?
Yeah, just thank you so much for sharing this project. I've heard about the BC Cancer internship, planetary health internship program, and every project I've heard about has been amazing. And also thanks for doing all the legwork to follow that plastic waste back to Oregon of all places. Like I've always known that dioxins were produced when biohazard waste was incinerated, and I had no idea that it went so far from northern BC. I'm curious about incineration of what goes in the sharps containers, because I always see all the plastic parts of, like, I'm talking about non-chemotherapy drugs, but like all the plastic parts of syringes, which technically aren't sharps, that are often ending up in the sharps containers. And I suspect those might get shipped and incinerated too. Do you know what happens to those?
I'm just guessing here. I don't think those are incinerated. I think the yellow bins, I think, are processed closer to home. I think it's just the red ones, the hazardous ones, that we're shipping. As far as the plastic goes, I think what would end up happening is, I mean, it is a fact. One of the guys before me or after me did a project on exactly that. He put up signs saying, like, this is what goes in each one. This is what does not go in each one. And a lot of it is convenience because, you know, we're giving stuff, some of it's hazardous, some of it's not hazardous, some of it's garbage, right? So next to each bedside, am I going to have a big red bin and a yellow bin and a garbage can and recycling? Like, that's not realistic either. But it was putting the signs up about being really clear about, like, this is what goes in and this is what does not have to go in, did change our practice. But it's also got to be safe too, right? So if we're having to separate, you know, plastic and a used, like, we're not going to do that, right? But lots of garbage does go in, and he had to go check. He would have to do counts, like, of like how much garbage was in there that's totally not supposed to be in there, right? And then take pictures. And then when you see those pictures, you also feel like a piece of garbage because you're like, yeah, I've totally thrown cardboard in there or whatever, right? So again, the why we're doing this, and then pointing out and making it easy enough for people to make the change. But I believe the yellow sharp spins are closer to home.
We did a similar thing I'm teaching the School of Nursing at UNBC, and we did a waste audit of our laboratory stuff. And the garbage that went in the recycling was, you know, enough to contaminate it, and then recycling that went in the garbage. Of course, there was a ton of that as well. So I can imagine that biohazard is similar to.
Yeah. But it's much improved now. We're much improved.
Yeah. This is a great conversation. I hate to interrupt it, but we do have our last presenter. Next up, we have Sajal, who is presenting on EPFL, an ensemble penalized federated learning framework for fall detection. So Sajal, I invite you now to turn on your video and mic, share screen, and begin presenting. Sajal, are you there?
Hello.
Oh,
yeah,
there
I'm
we
here.
go. Yes.
So, but my connection was lost most probably. So I don't know. I was not hearing anything.
Oh, sorry. Yes, it's your up.
Okay. All right. Yeah.
Yeah.
Okay. I think I'm going to share my presentation. Can everybody see my presentation now and can hear me?
Yes. Yep.
Okay, all right. Thank you so much for giving me this opportunity to present my work here. My presentation was in another session, but due to some time conflict, I have to present here in this particular session. Okay, so I'm going to present my research on an ensembled penalized federated learning framework for falling people detection. And this research was done by my student here, Cesar Rao, Rinku Jong, and myself, Sajal Shaha, and Dr. Liang Chen. Now I'm going to present this work on behalf of all authors, and I'm an assistant professor in computer science at UNBC, and I'm the founder here of my Inform Lab. And I'm working on cybersecurity using machine learning and AI. All right, so before presenting our work, I want to acknowledge the territory. We respectfully acknowledge that the University of Northern British Columbia is located on the traditional and unceded territory of the Kletli First Nation, and we want to express our gratitude for the opportunity to live, learn, and work on their ancestral lands and recognize their enduring connection to the territory. All right, so this is my outline of our presentation today. So first of all, I'll introduce my problem and what's the research motivation behind it. And then I'll summarize some related work that actually motivate us to propose our EPFL framework for fault detection. Then I'll share some experimental setup, that the data set we used and the model we used for the training. And then we'll discuss some key findings from our research results, following by conclusion and future work. All right, so so far, like this research is basically motivated on in case of identifying the falls. So falls among elderly and physically challenged individuals actually represents one of the most critical cause of accidental injury and mortality worldwide. So according to WHO, the second leading cause of accidental injury of death is falls, and 38 million disability adjusted life years happen due to those falls. And we are trying to adopt some technology for predicting or detecting those fall automatically based on some technologies that require accuracy, that requires privacy aware and adaptive fall detection. So in case of traditional approaches that use rule-based threshold or vision-based solution, there are some limitations. So for example, rule-based solution giving us poor generalization in case of detecting the falls in diverse scenario, and vision-based solution giving us a risk of privacy. So for example, like if we want to take the vision-based solution, that can leak your privacy data. That's why like machine learning can be one solution, and centralized machine learning can give us better generalization, but that has also an issue of privacy, because that requires data for centralized training, and that centralized data can be leaked to the outside people and can impact the privacy. And that's why we feel that we should use federated learning that has an inherent property of keeping the privacy, and that provides a distributed learning through machine learning models. So federated learning gives us privacy preserving, and through our proposed model, we try to improve the generalization that can perform better than the traditional approaches we found in the literature. So before starting our technical presentation, I want to give you some idea about federated learning. So in figure 1, this shows a very schematic diagram of federated learning. So as we all know about machine learning, and machine learning model needs data for the training. And whenever you're collecting data, that data can be leaked to the outside. And that's why we need some kind of decentralized way of training model, and federated learning is for that. So for example, in diagram 1, we collected data from different sources like mobile phone, computer, your personal tab, for example, and all data is sent to the server for decentralized training. And after training, the weights of the model updates sent back to the client device, so that we can have better generalization with privacy preserving opportunity as well. And that's why we choose federated learning for this fall detection work. What are the key challenges we try to mention in this work? So for example, accuracy and reliability. So differentiating between false versus quick sitting or lying action is one of the challenges. So our model, we try to propose some model that can give us reliable and accurate fall detection results. And also we concerned about the privacy, that we collected data from different sensors, and we train model based on decentralized approach, so that we can avoid the privacy risk. So to address those challenges, we proposed ensemble planized federated learning, which provides privacy preserving and personalized federated learning framework, which ensures data confidentiality through homomorphic encryption, and also provide enhanced accuracy and robustness through ensemble modeling and penalized training. So ensemble modeling means that we are collecting response from both local models and global model, and we are ensembling them to give a better results. And also incorporates continual learning loop to adapt user involvement in case of getting feedback. So that can give us better performance over the time, having continual feedback from user. And the key contribution for this work is we proposed a new specialized weighted aggregation. Federated learning applied some traditional aggregation for aggregating weights from clients, but we proposed something new, that is a specialized weighted aggregation. Also, we proposed a dual mode ensemble approach that merges global and client-specific prediction for personalization feedback. And a feedback-driven continuous learning loop, that is another contribution from our research that enables adaptive model updates. All right, so those are the main thing of our proposed research, the motivation and key challenges that we tried to investigate through our research. Now I'm going to explain our framework from very high level. So this is a kind of high level diagram of our proposed model, and we can see that there are different units that I'm going to explain a little bit from high level. So for example, the first module here is the data encryption module, that we are collecting data from the client, and the client data has been encrypted using a technique called homomorphic encryption before feeding it to the machine learning model. So machine learning model actually doesn't know the actual data. They will get the encrypted data and they will train based on the encrypted data, and we applied homomorphic encryption for that. And also we worked on specialized weighted aggregation after training the client model, how we can aggregate the weights. So generally the federated learning applied fed average aggregation technique that we actually replaced here using something new called specialized weighted aggregation, or SWA. Then in case of inference, like after training the model, we need to get the results, testing or inference, that we apply the ensemble inferencing, meaning that we make the decision based on client update and the global model updates that give us more accurate results. And also we included the feedback driven learning into our framework, and as a whole that giving us the proposed framework for better accuracy, better fault detection accuracy with privacy preserving and encryption. And this is our model architecture that we used for our client training, and that is LSTM model that we used with multiple layers and some technical things like what kind of activation function we use for that, and then what kind of training strategy we applied for this model. Now, I want to go our next part, that is called model training. So in model training, as you know, that machine learning model training is very challenging because your model can be overfit or your model can be underfit. So in our case, our model training was established after 45 epochs, and we can see that our model training was optimum, and that gives us a stable convergence and efficient optimization under federated constraint, meaning that our model performance is not overfitting and not underfitting. We are getting an optimum results from our model, which is very important for a research with machine learning model. Now, in case of experimental setup, we use some publicly available data set, a wearable sensor data that we pre-process first. For example, we change the alignment and we do segmentation. We apply some technique for data imbalance, and then we use those data for training our model. We use different matrices, for example, accuracy, precision, recall, and F1 score for evaluating the model performance. And to compare our model performance, we consider some baseline models like support vector machine, random forest, isolation forest, and some unsupervised classification model like HBOS, LSTM, and FL variants. In this table, we actually summarized our key findings, and if you look into here, that the proposed model like EPFL with a specialized weighted aggregation and multi-sensor data giving us the highest F1 score, that is 89.94, compared to all other models like the baseline model and some other variation of the federated learning, and that demonstrates that our model is giving us better F1 accuracy and precision compared to other baseline model and other variation of the federated learning model. So again, it's giving us high recall and very low precision, and also it giving us the balance, both precision and F1 score, and it shows a consistent client-wise recall. We considered 4 clients for our training, and it shows a near centralized accuracy while maintaining the full centralization, meaning the privacy of the client. Now, the conclusion is that robust fault detection using ensemble and penalization technique that we achieved through this model, and then that preserve the privacy, and then it adapts to the behavioral changes, like since we are dealing with different sensors, and also it outperforms the centralized and baseline FL models. In future, we want to advance the privacy, securing multi-party computation, and we want to do the group-based personalization, for example, based on age, gender, or physical traits, and also integrates with the IoT healthcare network and Edge AI. And that's all of my presentation, and thank you for listening me. And if you have any question, please, you can ask me here. Thank you.
Wow, that is so interesting. That is like a lot of work in
I'm sorry.
in a short amount of time. That's great. I might have missed it, but has this been implemented in testing in any like hospital or long-term care facilities, or am I just completely off the mark?
Okay, so currently we perform this simulation on computer. So we collected data. I mean, we use data that is publicly available. But now, if we want to test on the real environment, then we have to make a module that we can incorporate it into a device, for example. So it could be a wearable device that device can implement it with the algorithm that we proposed. And then that algorithm is basically collecting data from different sensor, for example, like ankle sensor or like different body sensor that we need for our algorithm. And if we can provide the actual sensor data to the model, then model can predict, but we need facilities for that I'm not familiar with yet. So, but I hope that at some point we can test the model in real world.
All right on. Thank you. Does anyone have any questions or comments?
I have a question. Can I ask? So y'all, thank you very much for this presentation. So I'm just curious about the reliability of these models. Like how accurate can they be in order to keep moving with maybe more advanced stages of your project?
Yeah, so in case of reliability, like for example, this is a computer-based simulation, right? So we are very confident that our model should give us better performance if we want to deploy that. Why? Because there are some kind of theoretical understanding or theoretical proof behind it, but we cannot actually 100% confirm without any field experiment, right? But according to theoretical justification, I can prove that the model should give us like the accurate performance. But still we need some kind of verification with real data. So based on reliability, like we are using like federated learning, like we are collecting data from multiple clients. So for example, that we have 1,000 elderly people who are sending data to the server, for example, or who are training the model on their own device, let's say, and they're sending the updates to the server. And server aggregate all the results, meaning that they having the knowledge from all the populations. So there would not be a problem regarding the generalization, regarding the reliability, because that is the fact from the federated learning, that federated learning giving us privacy, also reliability. So we are not missing any population data in our model, meaning that we are expecting that it will give us a reliable response based on the population history. And in case of accuracy, that our model is giving us now, let's say around accuracy of 90%. And there are some room for the improvement for sure, because 10% is still like lots of like false alarm we can get from there, right? But we have to test, we have to train the model with diversified set of data, and that can maybe give us better accuracy at the end.
Thank you very much, and all the best in the next steps.
Thank you. Thank you.
Does anyone have any more questions or comments?
So this is a question for me, like when can we expect the model to be used to set off an alarm to third-person caregivers? Okay, so now that's alarm, like, again, so I know, like, I'm new here at UNBC, so I came here recently. I'm trying to get you familiar with Northern Health and the research that in this domain, for example, at UNBC and outside, so that I can know what's the process of collecting data or experimenting with real data and all, and I can deploy that model for the system verification. So I don't have any exact timeline yet, as I am trying to just figuring out how can I do further as a field test, and definitely I'd be happy in future to let you know when it is ready.
Right on. Okay, well, we are almost at time. So I wish to thank our presenters today in sharing their experiences, projects, research. There's such great work happening, and I'm so grateful that we're able to have you in Circle today. And thank you to our participants and your curiosity in Northern knowledge generating activities. This is going to be the end of the session now, so enjoy the rest of the conference. Thank you.